where she has gained her education at Lund University and has been a practitioner of uh, psychological and psycho their psychotherapist psychotherapy for over 25 years. She, I think, is truly an experimenter and a developer of her understanding of human, the inner aspects of human beings and how they affect their emotional and physical lives. She's a registered physical therapist, and she has an MS in stress and psychosomatic sciences. She has focused a great deal on psychodynamic body therapy, basic body awareness therapy, and received the Guild Certified Feldenkrais, I hope I pronounced that right, practitioner. Her talk and her
maybe it's better to do it now than after. I don't know how long my voice will be able to keep. Can you hear me? Okay. Thank you for your understanding. I woke up this morning, and don't worry, it's totally psychosomatic. Not contagious at all. So, Caroline told you a little bit about my background. And so I work within the Swedish healthcare system, and I've done so for almost 30 years. And I have been interested, as Caroline was pointing out, to the connection between how the mind affects the body and how the emotions affects the body. And this is also what I teach at university, where I have been responsible for a 10-week course in psychosomatic medicine. But before we dive into the topic, I would like to invite you to think about 3 questions. Will you please take the next image? So we keep these questions live as I go along and talk about this. So what is it that you find stressful? What is it that triggers stress in you? And how does it affect your mind? And what kind of coping strategies do you have in order to deal with it? Is that 3 questions that are acceptable to think about along the lecture? If nothing else, hopefully, it keeps you awake. So we can take the next question. The Swedish healthcare system, as many of you know, has been famous for working pretty well. But over the last 15 years, I would say, we have faced real economical crisis. It still doesn't cost more than $22 to go to a doctor, $22 to have a bypass or any other surgery. But we have had a tendency to objectify patients. An average practitioner, MD, has about 15 minutes with each patient. And if you're a specialist, well, then you have 25 minutes. In that limited time, you have to figure out what is the diagnosis and how can it be remedied. And most of the time, patients walk away with either a prescription for antibiotics, tranquilizers, or some kind of antidepressant. The antidepressive drug is one of our most highly selling drugs in Sweden. So you could say that it's absurd. We talk within medicine about an asthma patient or pain patient, chronic pain patient, and we make people walking diagnoses. And we find this absurd, but isn't that what we do with ourselves? Now just take a moment to think that you will be driving down the freeway on your way down to Los Angeles, and you have a really, really nice car. And when you come to about 1,000 Oaks, you see that your oil lamp on the dashboard is blinking or is red. What do you do? Well, we don't know what to do with reading problem. So what do you do?
check the water, make sure your water.
Check the water, and also is the oil lamp. You want to check the oil lamp, right? I don't think there is anyone here in the right frame of mind that would take a piece of duct tape and put over the lamp. Right. We think it's funny, but that's the way we treat our bodies most of the time. Have a physical illness, we want it fixed as quick as possible to as small cost as possible, right? Okay. Can take the next picture. So are we treating ourselves as subject or object? And that is actually my main aim with the course I have at university. My main aim is that after 10 weeks, the med students, the physical therapy students, and the nurse students will be able to see something else than a walking diagnosis. Will be able to see the person behind the scene. This comes from Ken Wilber. Someone familiar with Ken Wilber? Out of Colorado, one of the great thinkers of our time. And what he has done, he has looked at disease in two different categories. And the first category here with illness is fairly easy. That's the clinical part of it. And it's remedied by clinical measures. So if you have a broken bone, it has to be mended. If you have a heart attack, something must absolutely be done quickly. And if you have a malignant tumor, you have a form of cancer cells that can have different, how do you say, grades. And depending on what grade it has, you have to treat it in specific ways. This is the easy part. But what Ken Wilber points out is that what we also have to deal with is the sickness part. Now, say that I've been diagnosed with breast cancer, and I've had a relative that have passed away in the most gruesome conditions. That will affect my mind totally different than if I have a relative that has passed through it and have come out the other way, beautifully cured. So if we just treat things from a clinical perspective, what we have seen in Sweden is that patients keep on coming back and back and back, either with the same symptom, the same illness, or the illness will take other shapes, come out in different ways. But if we don't address the sickness part of it, we're never actually going to help a human being to be healthy. I'm almost getting my notes. You have to excuse me. You can go to the next. What do you think is the one most crucial obstacle in rehabilitation? What is it that is the most hindrance that we get well? Yes.
Reluctance of the patient to change?
The reluctance to change, yes. That comes a little bit later.
Fear?
Before that.
Fear?
Fear is another thing, yes.
I would say attitude, positive, negative.
Positive, negative attitude. But you know, the foremost obstacle is if the patient is identified with a disease. Mm-hmm. I have many patients that come to me with chronic pain syndrome, and have obviously have had it for a long time. And the more identified they are with it, the more difficult it will be to rehabilitate. Mm-hmm. Because you need always to create something bigger in order either to contain the disease or being able to deal with it in a conscious way. So for this sake, we have to create something more than what we are seeing in the patient. You could say, can a patient be healthy even if it is disease struck? And I would say I had a patient, she's no longer with us, but I had a patient, a 54-year-old single mom, who when I met her was diagnosed with cancer, with metastasizing, and she was given about 2 years to live. Now she still lived after 15 years. Mm-hmm. And she was one of the most healthy patients I ever met in my entire practice. She had her disease to struggle with. She had these two children that she was determined that she wanted to see them grow up, become as old as they could live on their own. And then she would be satisfied. And when the last daughter moved out, she passed away. Mm-hmm. But I helped her to alleviate the pain on and off. But it was never that she was identified with her disease. And I thought it was really an eye-opener to me. Please, we can take the next one. Does anyone know of Aaron Antonovsky? Aaron Antonovsky was one of the pioneers within the field of clinical research to find out what is it that makes one person rehabilitate in 2 weeks, where another person takes 2 years. What are the factors that actually is within the resources of a human being that either makes it or breaks it? Can I have the next question? And these are 3 points, and the reason I bring them up is that we will see in noetic psychology, these 3 points are very much similar to each other. The first point is if the individual has any sense that they will be able to manage this disease, that they see themselves as something more than the disease, that's a very, very good point for knowing that it will be a rehabilitation that is successful. There also has to be an element of comprehensibility, not just chaotic. I need to have some kind of sense of order in my life. So I feel that I have a structure to fall back upon. And the third one is meaningfulness. And meaningfulness could be a religious belief. It could be have a good family situation. It could be things like for my patient that she wanted to survive long enough to have 2 daughters to be brought up. But we need that meaningfulness. Yes. Sweden joined European Union in 1995, and we had a recommendation from the Swedish government that everyone within the Swedish healthcare system had to be able to answer the most basic question about alternative or complementary medicine. Not that every one of those are covered by the Swedish healthcare system, but we have to be able to inform the patient. And they also started up different faculties within the different universities in Sweden in order to have a look at what is called integrative medicine. And what that means is that you look at the alternative and complementary aspects of medicine, and then you see which one of them can be classified as evidence-based. And those that can be classified as evidence-based will eventually be included in our healthcare system. Is that the same here? No. Okay. No. We can take the next picture. So that brings us into noetic psychology. And noetic comes from the term nous, which is a Greek term, a Platonic term. And it sort of points to that within the human being, that's something in us which doesn't change, which is of a spiritual character, and which actually enable us to feel that we are part of the whole universe, the whole world. That we are like a living cell within the greater or bigger unity. Then take the next one. So noetic psychology doesn't just look upon the relationship between myself and my emotions, my intelligence, and my behavior, but it also looks about ethics, morals, and spirituality. So you could say it's an integrated view of the human being. So if we want to sum it up, you could say it's a totality of the individual and his relationship to existence at large. We can take the next picture too. So noetic psychology say that there are 3 points of importance, and they correlate pretty well with what Aaron Antonovsky said, but it gives it a bit more spiritual perspective. So we can go on to the next picture. This is the biggest question there is to ask ourselves. Who am I? And it's a question that has been asked throughout many spiritual traditions. And one can ask oneself, why is that important for me as a therapist or practitioner? Well, if I cannot come across with that question to my patients, I will never see any result in the rehabilitation. If my patient cannot see themselves as something more than their problems, the problem will never get solved. Mm-hmm. I would like to ask you all to close your eyes for just a few moments. And now we just take a brief journey backwards in your memories. and see if you can get an image or an experience of how you felt that your body was when you were 20. I guess for most of us, we can realize that there is a difference to how our body is right now, and how it looks right now. It certainly is to me with this kind of whiskey voice at least. Okay, has everyone got sort of an image of that? Okay. So now go back in your memory to when you were teenagers, just in the middle of the teenage period. And just try and remember if you can sort of picture what kind of emotions you were feeling at that time. Were you kind of a revolutionary teenager? Were you very obstinate? How was it for you? And let that go, and then go back about 10, 15 years and see and try and perceive what kind of concept did you cherish at the time? How was your thinking at the time? Has it changed within the last 15 years? I would hope so, since life is a continuous evolutionary process. So has everyone got the three levels? The physical, the emotional, and the cognitive? Now can you please tell me who it is that is witnessing all these differences? Who is it?
The self now.
Excuse me?
The self now.
The self now. So there is something in us which is actually being able to see and perceive the changes. And in order to perceive changes, there has to be something that is changeless in us. So noetic psychology says that there is a spiritual basis, a consciousness basis for all of us that we have in common. And this is sometimes called the pure consciousness, the pure awareness. But it's that which is behind, you could say, the relative reality. Because everything we perceive in everyday life, there's one thing we can be certain about, and that is change. It will change in one shape, form, or another. We can take the next picture, please. So in noetic psychology, we tend to say that we are a spiritual being having a human experience. And we can take the next one as well. And is there anyone that can read that for me? So I can spare my voice a little bit. Who will give it a go? Yes, Carolyn, please.
If we could ever know and understand our natures, we must first understand that there is in us that which never changes at all. Whatever changes are brought about by it. We never are the things we see or feel or hear or know or experience.
Yes.
Robert Crosby.
Thank you. Excuse me. We can take the next image, please. So if we look at noetic psychology, in their philosophy, we could say that there is that within us which can perceive, which can witness change, and that pertains to what is called the individuality, that is the I in the blue triangle. And individuality comes from the Latin word individus, which means indivisible, which seems to indicate that we are all connected on a spiritual level. And we can see that there are three aspects of this spiritual level. There is what has become popularized as the witness position, in mindfulness, for example. And the witness position, we must remember that the witness position that we experience in everyday life is maybe not the same as the one we experience in high levels of meditation. There is a gradation there of the witness position. And you know that exercise we can say, we can witness things, and then we can start to witness the witness. The intuitive part, according to noetic psychology, is not really to be able to know who's going to be on the phone before I pick it up. It could be part of it, of course, but the noetic psychology more talks about the capacity to see things and perceive them as they really are. Because most of us are brought up in a certain way, we have all the experience that we've been going through childhood. And so we very rarely see things as they really are. But the part of noetic psychology is to be able to try as much as possible and perceive things as they really are. And for this, we also need the self-reflecting capacity. And we can see that the way we relate to the world is that when we are focused in this, you could call it higher aspect of the mind, we can say that we perceive the world as an integration, and that's what we strive for. And if we are totally caught up in the P, which is a shortening for personality, or persona, or the mask that we sort of carry with us in this life, then we can say that we see ourselves more like separate beings. And of course, in our personality, we have what we just looked at. We have the bodily patterns, we have emotional patterns, we have cognitive patterns. But if the therapy would consist of only this part, it would be like a sheep governing other sheep. Am I pronouncing this right? Sheep. Okay. Okay. Normally, when I say that, people think it's inexpensive. Oh. Because I have a problem with those vowels there. But we need something more. I cannot break out of a pattern if I'm not something more than the pattern, right? Mm. So we can say that ordinary psychotherapy and psychology normally deals with this part. It's behavioralistic. Whereas we need to go up one level in order to be able to change something on a true basis. Any questions or thoughts so far? Yes?
Does P stand for psychic? The letter P stands for...
This is for personality.
Okay.
Yeah. And I'm happy that you brought that up because in contradistinction to noetic psychology talks about the persona or the personality as the psychic aspect of it. Psychic basically means that it's based on our sensory perception. So, because most of our cognitive, emotional, and bodily patterns are being triggered by the seven senses or the five senses. So we need something more in order to be able to not just move into reactions. We need to act instead of react. I can think it makes sense. The next question in noetic psychology is how does it all work? I mean, if I'm going to change something, I need to know how it works, right? There has to be some kind of structure. So what noetic psychology says, if we take the next image, it says that there is one law in the universe, and it's the law of periodicity, or cycles in nature. Now, cycles in nature is something that is so obvious to most of us, right? We can see them the whole time. We can see how the weather changes. We can see how night and day changes and so forth. Right? But what we tend to forget is that our emotional nature, our cognitive nature, it also has its own cycles. And that's what in noetic psychology is called intrapersonal cycles. So if I want to change a thought pattern, I need to figure out, first of all, when is that thought pattern the strongest? When is it that I sort of notice it the most? Is it in certain situations? Well, that's absolutely necessary to know because you want to be able to exchange it with another type of attitude when those moments come back, right? Same thing with emotional patterns. If I know that I'm triggered somehow by some, how do you say, triggering thing in my emotional patterns, well, I need to become aware of it. If I'm not aware of it, I cannot change it. We cannot change anything that we're not truly aware of. We also need to know in our biophysical cycles. Huh? So we don't book in a lecture the morning we're going to wake up with a bad throat. Let's take the next picture. And in noetic psychology, we also have to find out what is the purpose of my life. Is there a larger purpose than just within great quotation marks to just live here, go out, buy things and objects, and eat good food? That's very nice. It's all very nice. It's not that we should deny ourselves that. But is there something bigger than that? Well, if I have a patient that is diagnosed with a severe cancer, for example, to eat good food may be one important thing, but there may also be an existential aspect that we need to talk about in our sessions in order for the patient to come to grip with what they are facing. You can take the next one. I think that Albert Einstein, he really summed up what the spirit is about. Could you read that as well, Karen, please?
My religion consists of a humble admiration of the illimitable spirit, superior spirit, who reveals itself in the slight details we are able to perceive with our frail and feeble mind.
Isn't that beautiful? It's a different way to view it. Huh? We can take the next image, please. It's a little bit out of focus, the image itself, but I thought I wanted to have it with me in my presentation because Leonardo da Vinci is in this image presenting the human being's evolution. What we see when the man is standing like this is the fivefoldness, is the world that we can perceive with our five senses. When he stands like this, it implies the X or the figure 10, which by the Pythagoreans was considered to be the most holy number. So evolution for noetic psychology consists of discovering and developing our potentials so we can move towards an individual and collective integration. It talks about the one consciousness being a unity and that we are all different, distinct aspects of that. And that we have an enormous more potential within us than we can ever fathom in our everyday thinking. Take the next one. So basically, my whole goal for treatment plan for patients is to re-educate the mind. Have you ever gone to your doctor and your doctor has said, I'm so sorry, you just have to learn how to live with this? Many of the patients that I see that are chronic, suffer from chronic pain, that is what they hear from their doctor. Sorry, we cannot do anything more. We tried out all the painkillers. Tough kiddo, you're on your own. And when I started to work some 30 years ago, I worked basically with women between 45 and 60 that were stressed out of their mind. What I've seen over the last 15 years is that my patient group is between 18 years old and 30, 35 years old. In Sweden, 85% of all long-term sick leave is due to stress. Every fourth child has to see a psychiatrist or a psychologist. And as I said, the antidepressive medicines are scaling up, top up here. So I can only be like a midwife in the best of cases. The resources is already within the patient, herself. And I have to help her or him to explore it, to undiscover their potential. And I found more and more as I work, it's a question of asking the right questions. The questions that makes another individual hopefully start to think in a little bit of a different way. I go as far as I say that the answer is the cause and the question is the effect. Because you know how it says that in the question, the answer is concealed. So this is for me the greatest art or skill to learn, how to ask the right question. Because if I just go out and tell a client or patient how it is, I will have gained something from it. But not the patient, because it's not their own experience. So the thing is to ask for the right question in order to bring out so that the patient themselves answer the question. And then I have to provide tools, of course. How do you increase your awareness in existential, cognitive, emotional, and physical level? Okay, go on. Can you still hear me?
Yes.
Still awake? Everyone? Yeah, great. So the treatments methods that I use are, of course, very much dependent on the individual I have in front of me. There are certain physical examinations that one can do. I normally joke about it and say that the body is crystallized spirit or crystallized consciousness. So show me your body and I will tell you your life history. So there's a physical examination that goes before, and then we have to see where is the patient stuck. If the patient is only focused on the physical aspect, well, if I start to talk about existential things, that patient will walk out the door. And we say, oh, she got the wrong patient, she got the wrong notes. You know? You have to be able to sort of meet the patient wherever the patient is. Anyone familiar with Søren Kierkegaard? Our great existentialist from Denmark. I'd like to read something for you. And this is the basic thing that I teach my students, but he says it in such a beautiful way. He says, if I want to succeed in bringing a human being towards a certain goal, I will have to start by finding him at the point where he is and start there. If I cannot accomplish this, I am fooling myself in thinking that I can help others. To be able to truly help somebody, I must certainly have to understand more than the person who is to be helped. But first and foremost, I must understand the very things the other understands. If I cannot do this, it is not helpful that I know more and understand more. If in spite of this, I want to show how much I know and understand, this is due to vanity and pride on my part. And the disguised purpose is to rather to be admired by the other one than wanting to truly help them. All true helpfulness begins with humbleness towards the person I would like to help. And by this, I need to understand that what is truly meant by the desire to help doesn't mean the desire to rule, but the longing to serve. If I cannot achieve this, I cannot truly be of help. It's pretty good, huh? Not bad for Scandinavia. So now it brings us into, the theme of stress. You still remember the questions?
Yeah.
Okay. So if I just turn around and leave the room. So what is stress to you? Can I have a few examples?
Anxiety.
Too much to do at one time.
Too much to do at one time. Okay. We have the next image. Stress is so many different things. It can be to have too much to do at the same time. Well, was that the only thing? No one else have experienced stress here?
Well,
Sorry.
I said anxiety. Anxiety.
Anxiety, yes, anxiety is stressful. Yes, at the very back first.
Concern for someone you love, their health.
Concern for someone you love, their health, yes.
Like some kind of nagging fear of some impending bad event.
Yes.
Frequently.
So if I say like this, if I would see someone nodding off here, falling to sleep, if I only see one person, I can always say, oh yes, Joanne's been up since 4 o'clock this morning, so it's normal, she's normal. Now, but if I would have 5 or 6 of you nodding off, I would be having a problem, right? And I would certainly feel stressed. So stress can be so many different things for so many people. It can be that I have too many things to do at one time. It can be that I don't have anything to do because I'm unemployed. It can be all those things. But what lies at the basis of it, isn't that sort of the creepy feeling that we don't have any control over things? Our mind is getting flooded by sensory perception.
beliefs.
Excuse me?
Since beliefs can cause us stress.
Yes.
Well, that we think things should be a certain way.
Exactly. We face that problem right now in the Swedish healthcare system. We have very many devoted healthcare professionals who really want to do the good work and who truly care about their fellow human beings. But because the economical situation is as it is, we have so many that are frustrated because it creates stress not to be able to do what you feel is truly the right thing to do. So there are many, many different ways. You can have the next image, please. This is Pierre when he's helping me with some presentations. This is after 4 hours of it, where he's tearing his hair out. So stress is the cognitive, emotional, and physical way in which we respond to pressure. Now, let's take the next image and let's see if we can relate to the symptoms. Is there anyone that hasn't?
Well,
Go ahead.
There is some stress that's good, isn't there?
Very important question. Huh? So, is there positive stress? Well, any one of you been in love? In Sweden, there is a phenomenon just after Christmas. All the trips to the Canary Islands are on sale. So what you can do, you can phone to your travel agent, and by then you've had it with the darkness, with the cold. And so you can say to your travel agent, is there a last minute, unspecified trip to the Canary Islands? And then they may say, yes, if you can be at the airport in 3 hours. But that's positive stress, isn't it? Or if you have a little child who wants to look into their stockings for Christmas gifts. In Sweden, it's not like that. In Sweden, we give the gifts at the evening of the 24th, and we hand them out for Christmas. But from the morning when the kids wake up on that day, all the way through, it's positive stress. Now, is positive stress as bad as negative stress? What do we think? Well, you would think that it wouldn't be, but that's the pitfall. Stress in itself is a good thing. It's like driving down with your car and you really hit the accelerator. And the carburetor is sort of cleaning itself out, right? Now, if we would do that to ourselves the whole time, not a good idea. So stress in small amounts with a period of recuperation is healthy. But whether the stress is negative or positive, if it does continue without any break, it becomes really negative. So let's take the next image, please. So let's look what is happening in the body when we get stressed. What is the physiological perspective? Does anyone know? No one knows? Well, then I can say what I want, can't I? So we take the next picture. Yeah, right. We have an axis in the body called the HPA axis. It's the hypothalamus, which is one of the oldest centers of the brain. It's the pituitary gland and the adrenocortical gland. Now, you will learn some Swedish here because these are the Swedish words. So, when any of us encounter something that we feel stressed about, there immediately goes a signal up to the center of the brain called hypothalamus. And the hypothalamus releases chemicals that lets the pituitary gland know that it in its turn has to release chemicals to the adrenocortical glands. And then our bloodstream is flooded by cortisol. Does anyone know cortisol? So it's different from cortisone, which is the synthetic version of it. No? And then when we don't feel stressed any longer, well, again, we have the same mechanism going back, telling the hypothalamus to tell the pituitary gland and to tell the adrenocortical gland it's time to put on the brakes. What happens if we are stressed over a prolonged period of time? Three of these things can happen. There can be a brake failure. And what it implies is that there will not be that signal that tells the adrenal glands to calm down. But the cortisol keeps on flooding in the bloodstream. And this is what we see, for example, with people who suffer from chronic pain. There is a constant high level of the stress hormone in the body. And you know how it is. When we have a pain, we're not showing the best side of ourselves. Oh, we get snarling and things like that. Huh? It's more than me that does it, I hope. If it goes on, it can come to the point where the adrenal glands are fatigued, are too tired. So we have what we call no acceleration. Well, this is not a hit. Because if I'm in the middle of traffic, or I'm confronting a situation where I need a stress response like this, and there is no stress response, it could be very, very dangerous, right? And if this goes on and on and on, we get an increased sensitivity to stress. In the blood vessels in our body, there are small receptors. And what they do is that they capture the cortisol molecules, so to have a control over them. Now, if the blood is continuously being flooded by cortisol, the stress hormone, we can then see that the body is very clever. It starts to develop new receptors in the bloodstream. So they multiply. Or the ones that are already there become more sensitive. So how do we experience that as an individual? Well, if we have been under a long period of stress, sometimes it's enough that the telephone rings a little bit high. We go, oh, we get a startle reaction, right? So the patients that I see have sometimes depleted this axis to the point that, as one man told me, who has been going to the same work for 25 years, taking his car, he left his home, he went into his car, he put in the car keys, turned on, and he didn't know what to do. The cognitive faculty was so disrupted by the prolonged period of stress that he had been going through. It took 4 years of rehabilitation, and some of the cognitive capacities actually never came back. Any questions with regards to this? It's all crystal clear.
What's the, when you say disturbances in the axis, which is that, what exactly is the axis?
The axis is, you could say, the cooperation between these three centers. This is all within the hormonal system, the glandular system. And probably most people are aware of how sensitive the hormonal balance is in the body. It only takes to be a woman who experience it on a frequent basis. But men have their equivalents, so they're all equally that sensitive.
Thalamus is connected to thyroid?
Yes, you say that hypothalamus and the pituitary gland, then you have the thyroid, and then you have the pancreatic gland that's helpful. But for this specific system, I normally talk about this HPA axis. Let's take the next picture. So how do we view stress from the noetic perspective? Anyone that will have an opinion on it? Thought on it? What could be stress from a noetic perspective? Yes, Caroline, and then
Well, it seems that normally we're experiencing stress with the personality, and the personality really is kind of an instrument that it just makes it more chaotic.
yes.
So if we can access this noetic capacity, wouldn't that mean we could try to provide some integration into the experience and response?
I think you should come up here with someone who really knows. Yes, what did you want to say?
I was just saying, like, maybe if you can elevate, if the person can elevate their mental awareness so that they're not trapped in their kind of individual problem, like stressing them to see things in a different way, maybe that they can overcome stress.
Two excellent answers. Let's take the next image and spin on that one. Stress, you could say, is the movement aspect in the mind, in the emotions, and in the body. And as Carolyn was pointed out, bless you, it is affecting the personality. The individuality remains the same. So if you take the next one. So you could say that the stress is when the mind is flooded by sensory input. It becomes fragmented. Fragmentation and stress goes together. Don't you have a saying here in the States that my mind was all over the place? My feelings were all over the place? It's hard to collect oneself. You see that our whole society is based on an increasing amount of stimuli to tickle our senses in a more and more refined way. Take it, advertisement. Many years ago, I took my mother, who was then quite aged, to the movies. And she couldn't follow the advertisement. Because when she grew up, there was a lot less of this, and there was a lot less of fragmented things. But you know how it is when you watch a French movie which has a fairly slow tempo? One has to sort of set one's mind to it, right? Because otherwise, nothing is happening. The artist, that movie that didn't have any speech to it, silent movie, would take something to be able to relax into it and enjoy it. We may not enjoy it for other reasons. But there is something that we constantly need as a personality to have something triggered. Before leaving Sweden, I saw a documentary on roller coasters. And did you know that the roller coasters today, they have to invent so many more hair-rising, that's what you call it, the hairstyles on the head, attractions. Because the personal mind gets so accustomed to all these quick stimuli. So there has to be something else to trigger us. So the question is, if we come to the next image, is the mind using the senses? Or is it our senses that is using our mind? The senses are like horses, they run riot. And they carry us away. The moment we step into sensory perception, we get absorbed into it. And there's a great difference between saying I'm afraid or I have fear. I'm afraid, I'm totally identified with it. And for that matter, I would say 90% of fear are psychological fears, right? Now, if I come up to you, Carolyn, I shouldn't come too close, but I come up with a knife and I say, Carolyn, hand me your purse. You need to have a response. You're either going to smack me in the face or you're going to turn around the other way and run, right? That's a factual fear, and it has total physiological response. But most of the time, we are afraid of things that hasn't happened. I'm afraid of what might come the next day. I may have memory in the past that tells me something. And you know what? The brain cannot differentiate. To the brain, the fear is a fear. Anyone, do you watch hockey in this country, ice hockey?
Yeah.
Anyone keen on it? Not really? Baseball? Something else that is exciting? You're sitting in front of the screen saying, oh, come on. Anyone?
Basketball?
Yeah. So your heartbeat goes up. Your pulse goes up. You probably clench your fist. You probably even, stimulate your jaw muscles when they don't play the way you want. All those are reactions that when we were living as cavemen, they would have sort of a release because either we will fight or we will run. But we are exposing us to a lot of stress. And the latest research in Sweden, because we have many Swedish patients, and they go home when they are tired, they sit in front of the television, and they think it's a way to relax. And of course, it does the personal mind. But we shouldn't forget that the brain is register every single aspect of what we are watching. So we call it brain stress. Even if we don't remember one single thing of what we're watching, which is some part of the time the truth. Can we take the next image, please? So viewing this picture now instead as the mind, we could say that the noetic mind is the perceiver in us, which could perceive the changes that we need to be able to do in order to want to change something. But the noetic mind is also what synthesizes things together. I would say that the good criteria for an awakened noetic mind is someone who has the capacity of make connections. Oh, I see this here, this fits together with that there. To be able to make a synthesis of things and to see the whole picture. And from this we have the highest level of it, which we may represent with an enlightened being, whatever that means in different degrees. And then we all have our sort of aha moments where we see the synthesized. And some of us may even be able to feel that we are part of a whole unit. And of course, what you were pointing out, awareness is the key word. To become aware of things is the only possible way to change it. Now we instead look at the psychic mind, that is the mind that belongs to the personality. I mean, it's not like it's two different minds. It's different. This is the transitory aspect of this. This is the personal aspect of it. And it's basically guided by desires. Desires, and here we could have put will. Will has by some been called spirit in action. And when we truly will something, in contradistinction to desire something, we will find, if we look closely at it, that it's actually something that benefits more than ourselves. It benefits the larger whole when we use the will. Now, noetic psychology says we have a free will as human beings. But if we didn't have that, there wouldn't be any point of me standing here talking about it. Because if we don't have any free will, how would we ever be able to change something? So we have to use our perception, our awareness, and the spiritual will, or the true will, in order to discover what are the desires, what are the emotions, and what are the concepts and forms. Now, if there's something that the personal aspect of the mind loves, it's to form concepts. It's to box everything in. This is the way it is. I can feel safe with that, you know. Then I don't have to think so much, you know. I go in for political system, I go in for religious system, whatever it is, and I hold on to it. And I put on, what do you call those things you have for horses?
Blinders.
Blinders. I put on my blinders. And I don't want to hear anyone, you know, challenging my blinders with my belief system. So it's a question of how do we keep the mind fluid? In a sense that we are open to new things. And in order to do that, we will come into what you were mentioning, Carolyn. If you take the next image, please. Are you still okay with sitting listening? You know, being a physical therapist from the very beginning, it sort of bugs me to see people sit still for a long time. Are you okay with it? So it's just what Carolyn was pointing out. We need to try and create the stress-free center in ourselves by trying to aim for as much as possible to free ourselves from the personal mind and try and view things from a larger perspective of the high aspect of the mind. There was one wise man who used to say that in order to realize something, you have to dwell upon that which you want to realize. So everything is possible to change. And my work as a therapist is to be able to act as a pair of, you call it crutches when you walk around. Some kind of a psychological crutches for my patients until they learn how to use their own tools. Until they have the first little experience of, oh, this is actually working. I have a lot of people that suffer from panic anxiety attack syndromes. And anyone who has suffered from it or have met someone knows what a powerful emotion it is. If you walk into a room where there are one or two people that suffer from panic anxiety disorder, it takes a lot of concentration not to get sucked into it. It's so stressful. So you have to teach the patient different techniques, and we will try some of them here before those attacks come on. Because when the attack is a fact, well, I'm sorry, we are sucked into it. So we have to have a strategy how to deal with it before. Yes. So the question, you know who this is, right? Homer Simpson. So how can we let the mind affect the body in a conscious way? Well, as you all may have heard, there are good news for us. Today, one of the most exciting, I find, researches that is being done is what is called the science of neuroplasticity. You are aware, aren't you not, that it was almost only 25 years ago that we were told that we are born with a certain amount of brain cells. And if they get damaged, tough luck, nothing could be done. But you heard the revolutionary news, right? That it is renewable to the very last breath that we take. So what the science of neuroplasticity actually confirms with regards to noetic psychology is that form changes with the demands of consciousness. Can take the next picture. When we are learning something new, we are actually creating new pathways in the brain. These are synapses, like electrical transformer from one electrical impulse to another. And that's how we perceive the world through our senses. Now they have done studies of meditators, and they have studied them over time. And I don't mean the occasional meditator who meditates, once every fortnight, but really serious people who meditate maybe 6 hours per day. And they have been able to document that the convolutions of the brain actually changes. What they have also studied is that someone who is a very experienced meditator can actually keep an image for a couple of minutes without it moving. And in the group that you compare with, we have had students, of course, university students, always out of money and want to, earn some money, so they get into these research studies. They don't have a trained mind in the same way as the long-term meditator has. And they can maybe keep the image for a fraction of a section. And you don't even know if they truly think about what they are told to be thinking about, right? But the good news is that we can create new pathways. So then they have looked also at emotions. And did you know that each emotion that we feel releases a certain kind of chemical in the blood called peptides? And if we release the same chemical every time, if we have an emotional pattern that we follow, did you know that we can become addicted to that release in the bloodstream? And that is perhaps, speculating widely, one of the reasons why it's so hard to break a habit. Because there's actually an abstinence in the bloodstream itself.